Love is a philosophical mystery to us, but the biological chemistry is very simple as it is just a combination of many natural neurochemicals. Love is responsible for some of our greatest wonders, but like any other chemical, can too much of it be dangerous for us? Let's find out. Serotonin is one of the most important hormones we have as it has one of the largest varieties of functions in the human body. Brain-derived serotonin will normally act like a neurotransmitter in the central nervous system. However, gut-derived serotonin will normally act like a hormone in the endocrine system, and the body will naturally produce it for anything from using it as an innate antidepressant to reduce depression, sleeping, eating and digesting, healing wounds, stimulating nausea, bone maintenance, or even reshaping our moral judgment, and the list only goes on further. Serotonin is most commonly known for its regulation of anxiety and is one of the primary neurochemicals in love. This all being said, serotonin is one of the most toxic and addictive drugs produced by the human body, and the body normally avoids any excess production of serotonin. The lack of serotonin will more than often result in a very dangerous mental disorder which we all know and will only learn more about, and that is depression. Still, one thing serves to be more lethal than the lack of serotonin in the human body, and that is the influx of serotonin in the human body. When serotonin levels are too high, the body will begin to demonstrate a collection of harmful symptoms which is referred to as serotonin syndrome. Serotonin syndrome was discovered fairly recently in 1955 in a human case and was said to have been caused by the intake of serotonergic drugs. These are drugs which increase the levels of serotonin in the human body. It wasn't until much later in 1984 where we finally further researched serotonin syndrome with the case of Libby Zion. Libby Zion was a freshman at Bennington College in Vermont when she was rushed to the emergency room of New York Hospital Cornell Medical Center. For the next 8 hours, the doctors would struggle to diagnose Libby's condition while Libby struggled for survival until she passed away. Her case was studied and she was described to have a fever, agitation, disorientation, and strange jerking motions with her body. As for her medical records, she was prescribed serotonergic drugs for her long history of depression and the drugs were ultimately the cause of her death. Although serotonin syndrome is most probably caused by serotonergic drugs, even though it's rare, it may still be caused naturally. And to this day, no test can diagnose serotonin syndrome and it is only diagnosable when all other possibilities are ruled out. Serotonin syndrome symptoms are very dangerous, such as agitation or restlessness, confusion, rapid heart rate, high blood pressure, dilated pupils, loss of muscle, loss of coordination, or twitching muscles, muscle rigidity, heavy sweating, diarrhea, headache, shivering, goosebumps, high fever, seizures, irregular heartbeat, and even unconsciousness. When symptoms are minor and the patient is on serotonergic drugs, stopping the consumption of the medication may suffice as treatment. When symptoms are concerning, a trip to the hospital is necessary as the patient may need muscle relaxants, serotonin-producing blocking agents such as cyproheptadine to help block serotonin production, oxygen and IV fluids to help with breathing, drugs that control heart rate and blood pressure, and if a high fever is present, then a breathing tube and machine and medication to paralyze your muscles. In this course, we've learned about feedback loops and inhibition. And the only explainable cause of serotonin syndrome would be the use of serotonergic drugs, which have selective serotonin reuptake inhibitors, which periodically disable the serotonin inhibitors from blocking the production of serotonin and creates an influx of serotonin in the body which can lead to serotonin syndrome.